Hello, I'm Dr. Hilary Jones, and I'm pleased to say that I'll be working with your co-op pharmacy to help and support with lots of healthcare matters that might crop up. So let's talk about erectile dysfunction. Certainly, there's a lot of confusion surrounding this issue, and a lot of embarrassment too. Some people find it very difficult to discuss. But I'd like to clear the air here. We've gathered some erectile dysfunction questions from our members to set the record straight and hopefully point you in the right direction if there are any issues for you. First of all, what is erectile dysfunction? What do we mean by that? Well, basically, it's when you can't obtain and maintain an erection sufficient to have satisfying sex. And there are various reasons why it happens, why men can't have an adequate and satisfactory erection, and those reasons include stress, fatigue, anxiety, depression, too much alcohol, so psychological factors, particularly in younger men. And then there are physical causes, which we tend to see in older men. Circulatory disorders, high cholesterol, for example, high blood pressure, heart disease, narrowing of the arteries, which we call atherosclerosis. And there are other things like diabetes and nervous conditions such as multiple sclerosis to consider as well. So a whole range of factors that might be responsible for erectile dysfunction. Now, it is part of natural aging. As we get older, we tend to have less erections happening spontaneously, and it becomes more problematic to have a satisfying erection prior to sex as our age increases. We know that about 50% of all men aged 40 to 70 suffer from erectile dysfunction or ED from time to time. But, it's not just that age group that have problems. Many younger men have ED for other reasons. Sometimes it's performance anxiety with a new partner. It might be a relationship problem with an existing partner. It might be fatigue. It might be stress. It might be a medication that you're taking. So no man at any age is necessarily immune to the problem of ED. Are psychological factors more common than physical symptoms? Well, the answer is they're equally significant. As I've said, in younger men, it's often psychological. In older men, it tends to be a more physical cause. But there's usually an explanation for it. And it's worth discussing your general health, your general circumstances, and your lifestyle with your pharmacist or your doctor before thinking about treatment. The good news is that treatment is very, very often successful. And once a man's confidence is restored, it's often the case that the problem goes away. Well, ED can be treated in various different ways. It can be treated with medication, with general health improvements, lifestyle changes, and some natural remedies as well. I think the first thing to do is to consider lifestyle. Is somebody overweight? If people can normalize their weight, that will be certainly of benefit. Stopping smoking will certainly help. Regular exercise is going to be a factor to make improvements, and the avoidance of too much alcohol or recreational drugs also is something that you should put on your list of things that you can change yourself to improve the problem of ED. Now, when it comes to medications, there are medications which I'll come on to in a moment. There are physical treatments for people, say, with more physical causes of ED. Vacuum pumps, for example, can be very successful, but cumbersome when compared to medicines. And there's people who have relationship difficulties as a result, as a cause of their ED. Then there's obviously cognitive behavioral therapy, talking therapies and sex therapy, which might be more appropriate or used in combination with medications. Well, the right treatment for any individual is going to depend on their individual circumstances and the causes of their erectile dysfunction. So it would be worthwhile having a chat with your pharmacist or your doctor about the way forward. And what's important is your general health, if you're on any medications, what age you are, as I say, the cause, and the right treatment will be found. When it comes to a medicine, and by and large, this is the major treatment for the majority of men with ED. The medication might be branded or unbranded. It's a question that's often asked. What's the difference? Are they the same? A branded medicine is the trade name. For example, Viagra is a name that people will know. The generic name, the unbranded name, the chemical name is sildenafil. But sildenafil and Viagra are exactly the same. They work in exactly the same way. They have the same active compound within them. The dose will be matched exactly. So the way it works, the dose, the strength can be absolutely equal. So you can consider them as interchangeable. And that's important for people to realize. They work in exactly the same way. Which medication is best for any individual person? Well, it just depends on the individual circumstances. So depending on your medical history, your general health, the right medication can be chosen for you. And it's worth talking to a relevant health professional to determine which treatment would be suitable and most appropriate for any given person. It comes to the question then of, should the treatment be over the counter or do you need to get a prescription? Well, the good news is that Viagra Connect and generic sildenafil, which is exactly the same drug, both of these versions are available without a doctor's prescription, and you can get these over the counter from your pharmacist. And about 1 million men with ED have already done that very thing. They've obtained generic sildenafil or Viagra Connect that way over the counter. Another frequently asked question is, should my medical treatment for erectile dysfunction be a daily treatment or only as and when I need it? And the answer is, it's only taken as and when you require it, because most men won't be wanting to have sex every day. Then there are a number of myths and confusions about erectile dysfunction generally. So one of them is, does tight underwear wearing cause ED? And the answer is no, it doesn't. It can cause a low sperm count because the testicles are at a slightly higher temperature, which isn't conducive to efficient sperm production, but it doesn't cause erectile dysfunction. Does smoking cause ED? Yes, it can do. We know that it narrows the arteries and can diminish the blood flow to the penis. And so that is an underlying feature of ED. So smoking is an underlying cause. Treatment can cause ED. Tiredness can cause ED. Yes, it can. It's a psychological and common cause of erectile dysfunction. Can masturbation cause ED? Well, masturbation is a natural enough thing for some people to do. Can masturbation cause ED? Well, there's no evidence at all that masturbation, unless it's excessive, would lead to erectile dysfunction. Does ED only affect men? Well, in a way, physically it does, but psychologically it can affect female partners as well, because there could be relationship strains as a result of erectile dysfunction and a sex life that could be better. So it can affect both sexes in a relationship. What about riding bikes? People have heard that riding bicycles can sometimes be contributory to erectile dysfunction. And the answer is that there is some evidence that when you ride long distances, the effect of the saddle on the perineal nerves, which run under the next to the sit bones that you sit on your saddle, that can have an effect on the nervous system and the circulation that is needed to efficiently have an erection. What about low testosterone? Does that have an effect on ED? Well, the answer is yes and no. It is a contributory factor, but it rarely results in erectile dysfunction. So low sperm count yes, but erectile dysfunction with low testosterone, unlikely.